Hello people, I am SC and I'm back with a new video, and today's topic is shock. No, it's not that shock, it's circulatory shock. Okay, let's start from the very beginning, the definition. So what is the definition? So shock is circulatory shock is basically generalized inadequate blood flow to the body, basically the tissues of the body, which leads to reduced perfusion pressure. What does that mean? Perfusion pressure basically means the amount of blood along with oxygen and nutrients flowing to the tissues, so leading to reduced perfusion pressure, which results in inadequate oxygen and nutrient supply to tissue. So the last 2 points, inadequate oxygen and nutrient supply, is the ultimate cause of shock and why it's an emergency situation and needs to be treated immediately. So what are the types of circulatory shock? Number 1 is hypovolumic. We'll go into detail of each type. Then we have cardiogenic, obstructive, and lastly distributive. Distributive shock is a very broad category. It has again 3 further subtypes: anaphylactic, septic, and neurogenic. Some scientists take neurogenic as a separate category, but over here we'll consider it under distributive type of shock. So let's start with the very first type of shock, which is hypovolumic shock. So let's break down the word into 2 parts. So hypo meaning less and volumic meaning volume. So hypovolumic shock is due to decreased blood volume. So what are the causes? What is the etiology? Etiology means causes. So there are two types of causes. Number 1 is decrease in blood volume due to blood loss, which is blood cell loss, and number 2 is due to plasma loss. So blood has 2 components. Blood has the blood cells and they have plasma. So if either one is lost, then that's how the causes are divided. So let's start with blood loss. So let me paint a situation in front of you. You're in the ER, there's a massive accident, and the patient comes in, massive bleeding. This patient has gone into hypovolumic shock. So number 1 reason for blood loss is trauma, accidents, which could lead to massive bleeding. Number 2 could be a GIT bleed, a GI tract bleed, or a peptic ulcer. So peptic ulcer is a type of chronic blood loss. It happens over many days, for a long time, whereas trauma is a example of acute blood loss. It happens very fast. Then we can have postpartum hemorrhage, which is hemorrhage occurring after delivery or due to an ectopic pregnancy. So what is an ectopic pregnancy? It is the implantation of the conceptus in somewhere other than the uterus, for example the fallopian tube. So as the fertilized ovum grows, it will cause the fallopian tube to rupture and leading to bleeding and hence leading to shock. Blood volume can decrease due to plasma loss. So what are the few examples where plasma loss can occur? It can occur due to dehydration. Maybe this person has been in the desert for a long time, no water source, or due to burn victims, mostly due to 3rd degree burn victims, because their outer skin layer has been removed. Skin actually helps in conserving water in the body. So burn victims, their skin layer has been removed, so they have unopposed evaporation, and this will lead to dehydration and hence plasma loss. Or if you have vomiting, diarrhea, these are some causes of plasma loss. So how do you identify is this person suffering from blood loss or plasma loss, because depending on the cause the treatment will vary. So what can we do? We can do a CBC, and this will help us figure out the hematocrit. So what is the hematocrit? It is the number of RBCs in blood. It is the percentage of RBC in blood. So normal hematocrit is about 45%. So if this hematocrit is more, then we can understand, we can deduce that plasma has been lost, hence the amount of RBC blood cells in the blood is more. So if hematocrit comes as more, that means the person has suffered from plasma loss, which can be due to any of these 4 reasons. If hematocrit is less, that means the person has suffered from blood cell loss. So this is how the treatment is also going to vary. So if there is plasma loss, we'll give IV fluids. We'll give IV fluids. So what could we give in the IV fluids, the intravenous fluids? We could give normal saline, or we could give Ringer lactate solution. This could be a mode of treatment. If there is blood cell loss, like suppose there is a trauma, there is hemorrhage, then we could give blood transfusion. So before we go into the treatment options, I would like to clear some concepts. So when one person is entering into shock, the body obviously would have some compensatory mechanisms, because the body would not want to enter into shock. So what are these compensatory mechanisms that the body undergoes when in hypovolemic shock? So the blood volume has decreased considerably. Since the blood volume has decreased, the baroreceptors, which are present where? In the aortic arch, the carotid sinus, they receive impulses that the blood volume has decreased. What does blood volume decrease mean? It means blood pressure has also decreased. So baroreceptor sends impulses to the CNS. Now what does the CNS do? So the CNS, via its cardiovascular reflexes, it will vasoconstriction will occur, which will lead to rise in peripheral resistance. So rise in peripheral resistance means BP will rise slightly. This is a compensatory mechanism that the body undergoes. CNS will also send impulses to the heart to increase the heart rate, but this is not very useful. Why? Because the blood volume is so low that the end diastolic volume of the person is very low. Hence the stroke volume of the person is very low. So even if the heart rate is increased massively, the stroke volume is very low, and hence BP will not increase, because BP is after all the product of stroke volume into heart rate. So what I'm trying to say is that even though the body tries to compensate by increasing the heart rate, it is not too much use, because the stroke volume is very low. And why is the stroke volume very low? Because the end diastolic volume, the venous return to the heart, is very low, because in general the blood volume is very low. So how will you identify that this person is in hypovolemic shock? What are the symptoms? What are the signs and symptoms? So number 1, the cardiac output of the person is very low, blood pressure is very low, but the heart rate is massively high. Because of the compensatory mechanisms, the heart rate is very high. Person might suffer from hypoxia. This hypoxia might lead to cyanosis. What is cyanosis? Bluish coloration over various parts of the body, and mostly it is in the lips, tongue, fingertips, etc. So once you identify that this person is in fact in hypovolemic shock, we can move on to the treatment. As I already discussed, if there is plasma loss, I will give intravenous fluids. Intravenous fluids could be normal saline, or it could also be Ringer lactate solution. This will help in increasing the plasma. But what if there is the cause of the shock is due to hemorrhage? Then we need to do blood transfusions. And in the meanwhile, what else could we do? We could control the cause of shock. Control cause of shock. So suppose there's an accident, the cause of shock is hemorrhage, we'll try to stop the bleeding. If there is postpartum hemorrhage, we'll try to stop the bleeding. Like, we'll control the etiology of the shock. So we are done with hypovolumic shock. So next up is cardiogenic shock. This is one of the most common causes of shock. So what does it mean? What does it literally mean? It means that there is something wrong with the heart. The heart is unable to pump blood efficiently. So if heart is unable to pump blood efficiently, then blood won't reach the tissues, oxygen, nutrients won't reach the tissues. So that is the basic cause of cardiogenic shock. So what are some of the reasons cardiogenic shock occurs? It could be due to, suppose you had multiple heart attacks, multiple myocardial infarctions, MIs, multiple MIs, or suppose there is some valve stenosis. So valve stenosis means the atriovent, suppose there's an aortic valve stenosis, then the aortic valve has become narrowed, the aortic opening has narrowed, hence blood can't efficiently go through. Or if there's a mitral valve stenosis between the left atrium and the left ventricle, it could be due to arrhythmias. The literal meaning of arrhythmia is due to irregular rhythm of the heart. So, or it could also be due to congenital defects like ventricular septal defect. So in VSD, what happens is that the ventricular septum, this septum is not formed nicely, so hence pumping of blood is very inefficient. Okay, so since pumping of blood is inefficient, the circulating blood volume goes down. So in hypovolumic shock, in general, the total blood volume was going down. But in cardiogenic shock, the circulating blood volume has gone down. Hence, tissue perfusion has also gone down. So what happens is that sufficient oxygen and nutrients do not reach the tissue. Now, why does the tissue need oxygen? The tissue needs oxygen for various metabolic processes in order to produce ATP. So ATP production has gone down. Since oxygen is not there, the body will start anaerobic respiration. Anaerobic respiration leads to formation of lactic acid. Increased lactic acid in the body gives rise to metabolic acidosis. Now, all these points, metabolic acidosis, decreased ATP, they all cause depression of the heart. The myocardial contractibility of the heart goes down. Myocardial contractibility, and hence the shock is increased. It's like a vicious cycle. Due to shock, all this is happening, and due to all this, shock increases. It's a vicious cycle. So now let's go to treatments. So how do we treat cardiogenic shock? Basically, treat the underlying cause. So suppose the underlying cause is myocardial infarction. Suppose it's myocardial infarction, then we'll treat that. How could we treat myocardial infarction? We could do an angioplasty or bypass, depending on what is the cause. Or suppose the cause is valve stenosis, we could have valve replacement surgery. Valve replacement. Sometimes human valves are replaced with either valves of cow or pig. It's called bovine valve replacement surgery. Anyway, so we basically treat the underlying cause, and in the meanwhile we can give vasopressors. Oh, what are vasopressors? They're basically agents which cause vasoconstriction. It will help in circulating the blood. So what is an example of a vasopressor? It could be epinephrine. That's why in medical dramas they shout out, push one of epi, because this is a life-saving drug. drug. It will save you from cardiogenic shock. So next we come to obstructive shock. So basically what happens in obstructive shock is that there is an obstruction in blood flow or oxygen supply or nutrient supply. So what are some of the causes of obstructive shock? So if anyone's ever seen The Good Doctor, the very opening scene of Good Doctor, season 1, episode 1, they showed there was this airport scene where this billboard came crashing down on this child, and this child developed pneumothorax. So what is a pneumothorax? So this is a picture of the lungs. The green outline is the parietal pleura and the pink one is the lung. So in between there's this space called pericardial space, which is filled with pericardial fluid, and it has this negative intrapericardial pressure. So this negative pressure is very important to maintain respiration. Now suddenly if there's trauma, an injury, like for the Good Doctor case, there was a shard of glass entered the chest wall. Hence, if the parietal pleura gets injured, then air rushes in from outside and this negative intrapleural pressure is destroyed. This will cause the lungs to collapse. And if the lungs collapse, then this could cause the entire lung to either shift or the trachea to shift. So this is called mediastinal shift. Where is the heart located? The heart is somewhere here. So the heart gets compressed, or the vessels which enter the heart, the IVC, the SVC, they get compressed, leading to the obstructive shock. So pneumothorax is one cause of obstructive shock. What is the next cause of shock? So let's get a heart in here. Just like the lungs, the heart is also covered with a parietal pericardium, and in between the visceral and the parietal layer there is pericardial fluid. So the next cause is pericardial effusion, or also known as pericardial tamponade. So basically what happens is that there is accumulation of pericardial fluid within this space, the pericardial space, and it causes the heart to get compressed. So this is one of the reasons why the heart won't be able to pump blood sufficiently, and obstructive shock. The next cause is due to it could be due to pulmonary embolism. What is an embolism? It's a blood clot which gets stuck in, suppose, one of the pulmonary arteries, pulmonary artery. So due to this blood clot, blood cannot pass sufficiently through the pulmonary artery, and hence what does the pulmonary artery do? It takes blood to the lungs and gets it oxygenated. So the blood cannot get oxygenated, hence deficient delivery of oxygen to tissues, shock. So these are the examples of causes of obstructive shock. So how do we treat this? We treat the underlying cause. So each cause has a different treatment. So how do we treat pneumothorax? Like that first episode of Good Doctor, pneumothorax is treated by needle decompression. A little needle was inserted into the thoracic cavity. So how do we treat pericardial effusion? By pericardiocentesis, which is again inserting a literal needle into the pericardial space. How do we treat a pulmonary embolism? We could give thrombolytics, something in order to break down this clot and allow for blood to flow. So in something to break down this clot. So this was the basics of obstructive shock. So we covered 3 types of shock: hypovolemic, cardiogenic, and obstructive. We leave distributive shock for the next video because there are 3 subtypes and they'll take a long time to cover. So this is it for this video. Over and out.